everyone. I just want to introduce a new startup to Mask for Millions, and this is Nofi, and she'll be trying to get 700,000 people in Sumba protected by masks. And this is her banner. All make masks, all wear masks, save your village, save yourself, save your family, and the goal is 700,000. And we've got our HIDAS partners. So the project started off for Lombok Forgotten Children Injury Foundation. We help thousands of people each year, and we have several thousand volunteers, and our goal was to protect our volunteers. I didn't want to see my family dying or at risk, or any of the people we helped, which are high risk people. And we've been started about 6 years ago. This is the start of our project. We started in around the 6th of March producing from our disabled teams, and we trialled many different types of masks, and then in the space of 14 days we went from making nothing to outputting some 14,000 masks. The second stage of our project, we identified which masks to make, and we'd already had helped influence bring Indonesia and Lombok mask wearing by all into law, and then we started with $2,000 just to make our masks, and then we went into our 100,000 mask program, which was taking materials out to the village and having the village ladies make the masks. We identified them as our human resource. Indonesia has over 20 million ladies who can make masks, and then we started keeping that going, and then just recently, 2-3 weeks ago, we lobbied the government. They'd been watching us the whole time from being on newspaper. We had police partnerships and that, and they made 2 million masks for Lombok NTB Sumbawa, and those are out there now. So we're amplifying, and now we want to see the government take this to all the other regions, 34 provinces of Indonesia. So we pushed hard to be on newspaper. We masked up the army, helped them do it themselves. A big part of us has been our banners to empower our groups, and it really has rocketed, and that's only over a 2-month period. So these are our disabled teams when we started, very small, and they were outputting. So in 4 days, when we hit the villages, we had this 100,000 mask program. It was very easy to implement. We had these ladies. Each of these ladies' teams can make 270 to 340 masks in 3 days, 3 to 4 days. So we've got a very effective mask, and these are the ladies' teams on all sorts of sewing machines, non-electric, hand sewing, and this is Endri and our pioneering teams. We already had our volunteers in action, and all we had to do was get this material and get it out to the ladies in each village. We also were part of PMI, Lombok Red Cross. Endri looks after that. None of them had mask protection, so they're all masked up now. And then we had these banners out, and we used this type of mask. All wear masks, all make masks. Stop talking. COVID-19 is here. Mask at Gotong Royong, and that's all working together. Again, everybody, it doesn't matter what sort of material, just cover up. And with the masks we have are very easy to make, and young girls are making them, old people are making them. We're in the paper all the time, in the paper, pushing the story, whether it's disabled making masks or the importance of mask wearing above all other activities. Then in the streets, working with the police and handing out free masks in the villages, which were isolating themselves. They wouldn't allow people to enter their villages without being masked up, without containing the spread that there is. Made t-shirts to give our teams some credibility, and these t-shirts went a long way, and we masked up the elderly and the vulnerable. Sumbawa teams, and growing those guys, and remember we're doing so on almost no funding. Annie and Flores and out there a few days ago and masking up villages They don't have a strong government program yet, and not a lot of people realise the importance of masks. Yeah, in the night time, the team spirit's just been incredibly strong. People are seeing the importance of it. They don't have a lot of choice, and it's signs, do not enter the shops without wearing a mask, stopping that droplet spread from the nose and mouth, working with the social police, and then this is a nighttime activity where these guys have all been out on the streets with each police, and they've been with the police ensuring the laws of Indonesia. This is in Jakarta, one of the parliamentary people up there, and he's got our t-shirt on, all make masks, all wear masks, stop talking, COVID is here. And again, pushing that newspaper stuff, working with village leaders, and trying to get them, and at a certain stage they'll pay for the material. It's very cheap to mask up a village. $50 will mask up 500 people. And there's the boys out in the streets again with the police and making sure that the people who leak through. There's one of our shop signs: enter only if you wear a mask or nose and mouth covering. You can see here that it doesn't matter what kind of nose and mouth mask covering, a hijab's perfect. Just a lot of the ladies are just pinning them up. So this is interesting. 700 million instant masks, nose and mouth coverings for the world. There's 1.8 billion Muslims. Probably 700 million of these are hijab wearing people. Very easy for them to get their garments, the many different types, and just pull that across and cover their nose and mouth when they're mask wearing by all, MWBA. So reducing high contamination risk community pandemic risk factors to near zero. So our goal is to reduce that pandemic risk factor to zero or near zero. And Peter Honey's my name. So our first mission has been for Indonesia's 270 million people to have fabric face masks and understand mask wearing by all. And our vision is for all citizens to be protected by global human rights, with laws that implement mask wearing by all from infected people when faced with community pandemic risk. So we don't see the right of any person to be in the society who's ill. So I'm not the best person to present this. I'm absolutely gutted this whole global pandemic's happened. There's 4 billion poor people out there who are exposed, who are not given mask wearing by all advice. It's so easy to do, we've proven that. What we're discussing is not a theory. Mask wearing by all is the single biggest proven priority any advisor has to action. And if these people who are not actioning mask wearing by all to protect communities and countries, and it goes wrong, then they should be held up for manslaughter, or in some cases crimes against inciting genocide. Ill-advised Western people have pretty much caused the pandemic spread globally by stopping mask wearing. So that's our mission, I think. This is the most important. To stop any pandemic, the rules of engagement are all the same. Stop the host from spreading it. Stop the virus at its source. So for malaria, we stop it at its source by killing the mosquito. For polio, we vaccinate. And for COVID-19, we stop it at the source, the nose and mouth covering. So there's only one thing that starts a COVID pandemic. Viral droplet spread is expelled from the host's mouth and nose, reaching air and surfaces. So it freely comes out his mouth. And there's only one thing that stops COVID pandemic. Stop viral droplet spread from being expelled from the host's nose and mouth, reaching air and surfaces. So a face mask does that, it stops it right there. No host spread, no transmission, no pandemic. And remember, we're focused on the pandemic aspect of it. It's the pandemic that's caused the meltdown and the pandemic risk. There'll always be flare-ups, and these can be contained by all the other actions, but the nose and mouth covering. So the mission of COVID-19 is to destroy us in two ways. One way is kill lots of people. huge death, fear, suffering, hospital meltdowns. COVID destroys our health systems. And the second thing is it kills your economy. So with no mask wearing by all, it destroys jobs, bankrupts companies, trillions of dollars of loss and share market payouts. So COVID's second action and purpose is to destroy our economy. And the COVID lesson of all this is you're a losing country if COVID has either killed lots of people, put your country in lockdown, and destroyed your economy, or both, or either or both. So loser countries straight away would not wear face masks. They would do not wear face mask country. USA, England, Belgium, Italy, Spain, France, Sweden, Germany, Canada, Holland. They all lost their stability. They've got public unrest and against the lockdowns. A lot of people going broke, mental problems, all that sort of stuff. And they all had a big propaganda campaign. Do not wear a face mask. These are going to go down as historic lies and propaganda. They even ban people on eBay and that to protect their own communities by not being able to buy face masks in large numbers. So loser countries, so you may not have had a medical meltdown, but you still may have been a do not wear a face mask country like Australia and New Zealand, and you lost economically wise. So you locked everybody down. You played safe from the health side of things, but you ended up putting your futures in absolute financial jeopardy. It's interesting to note here that winning countries like Taiwan never went into lockdowns. They changed their unemployment ratios from 4.1 to 4.7% now. So they schools, everything functioned, and the only difference is mask wearing. So here we go again. There are only two types of country in this COVID thing: winning countries and losing countries. So the winning country first response was mask wearing by all, and loser countries who would not implement mask wearing by all suffered. So the winning country's first response, masked up. So Taiwan masked up, slowed down the movement, all those other things. But their deaths per million were like 0.3, Hong Kong 0.5, no lockdowns, no job loss, etc. A no mask wearing response, high death toll, to Taiwan's 0.3, Spain 544, UK 423. That'll be up now. Lockdowns, massive lockdowns, 15% unemployed in the States. This is something we'll go through another time, but these are the non-face mask wearing losers. There's massive amount of people affected. The death count per million, 777. Belgium, a lot of you thought Belgium were the winners, but not now. 590 Spain, it's all 500. USA 272. Well, if we took that into New York, it'd be right above the top because it's a big country and parts of it haven't spread to it yet. And so this the Czech Republic, which is right in there. They went into mask wearing fairly early compared to the others. They were down at 28 people died per million, as opposed to this 400, 700, their neighbours. And then Australia and New Zealand, we were late to get it. Very lucky, and we just went into lockdowns, and we had very low death rate as well, but we suffered economically. Hong Kong, Taiwan, Vietnam, they went straight into it, and 0.5, 0.3, the same population Taiwan is Australia, and no deaths, and they got hit right early. So, but they were COVID prepared. Here's another thing: winning countries versus losing countries. These countries says do not wear a face masks. United Kingdom, Sweden, Germany, US, Spain, France, all those countries. And then these countries here, and a lot of them aren't on there, mask wearing countries, but the real ones aren't even on this list. They didn't even get to have pandemic acceleration. So our point here is, start winning or keep losing. The goal is to get rid of the pandemic risk, not necessarily the flare-up risk. There's a big difference between a second wave pandemic and a second wave flare-ups. So don't get all upset when you're in a country that's having flare-ups, as it's the pandemic risk, we want to get rid of the mask wearing by all does that. So in 3 months we can be globally pandemic free if we all mask up. It's simple as that. Now this is on TV yesterday. I managed to capture it. This is a very dangerous lady. She's the one that's confusing. She's killing. She's part of an organisation, and they're out there as a group protesting. So,
and for face masks to be banned immediately, so that we can live again in a democracy. That's what I stand for.
Banning face masks immediately.
I am a human being, and as such, I would like to live and breathe. With a face mask, I can't do that. I call for the immediate abolishment of face masks. We are not dogs, not animals. We are human beings.
So the immediate abolishment of face masks. I mean, this is really dangerous stuff. So we've got to keep her point of view out of the media of poor countries. This is all out there. It confuses people. In Taiwan, this sort of action against face masks, she will be heavily fined. In some countries now, they've got $50,000 fines for inciting this sort of it's genocide. You know. Real super important. 3 pandemic actions. There's only 3 pandemic actions to take. There's the attack action, defend action, and retreat action. So the attack action is to stop it at the source. This is the action to stop it at the source, and mask wearing by all is the only choice to stop it at the source, apart from vaccinations, which will stop it at the source as well. But of course, we haven't got vaccinations. Then once the droplets have escaped from the nose and mouth, the virus has actually succeeded. It's done its job. It's out there in our communities, and all the actions after that are defending actions. So COVID, once you're defending, COVID has the winning hand. The viruses are out there. It's going to, your pandemic risk is huge still, and it won't stop it unless it's a really like community contamination risk factor. And then there's the retreat. Retreat is defeat. So when you start getting overwhelmed, or if you go into lockdown early, you're being defeated by COVID. It's going to kill your economy. So you know, some countries have gone into lockdown because of hospital meltdown, and gone into lockdown to or gone into lockdown just to protect their economies. So either way, if you're in defeat, you're losing. So this is just an interesting video. So the droplets come from the nose and mouth source, from breathing mostly. All right, so it's coming out there. So a cough and a sneeze. Most people aren't coughing or sneezing, and it just spreads out there. One cough is 3,000 droplets and tens of thousands of viral cells in these small micro droplets, and then the droplets are left. That's really dangerous in the places. So there's the mask catching action, and up to 100% can be caught in the mask. So all of a sudden it's caught in the mask, and all these other people are, you know, the contamination risk has dropped right down low. And just remember, you know, a single cough, 3,000, you know, we're not coughing, 3,000 droplets and tens of thousands of virus spread. When everybody's wearing a mask, not only is this mask wearer stopping all the droplets coming out, the amplified effect for this guy, that mask has got very little to do. So if you're talking to someone wearing a mask and you're wearing a mask, his mask's doing all the work. More, you know, 99% of the work, 98% of the work's been done by his mask, and that mask is able to block whatever's left, distancing and all that. So distancing's what everybody's yelling. It's not a priority. This is about running and how you should run behind people, so you can see the droplets coming out. Well, that's with you running forward, but there's, you know, we know what the wind is and all that. It can go anywhere. So it's a lovely graphic, but it's just poor information again. But if it was talking about wearing a mask, a nice mask for running, it doesn't have to be tight, then it's blocking up to 100%, and no matter where you are, if you're wearing a mask, it's giving you extra things. So we've got to block it at the source, and this is a ratio. It can get up higher than that. There. So it's important to mask wear and distance. we understand distancing. The further away you are, the greater you are, less it's safer. So under 2 meters is less safe, but it doesn't stop you from getting droplet contamination, and all the droplets are still going out. So distancing isn't stopping it at the source. Big problem we've got is our hidden people, our asymptomatic people. We don't know who these people are. 30% of people feel well, so they're out there, putting all their droplets out there. So when everybody was wearing a mask, we can check it. We don't know who he is, and we've stopped droplet and surface spread at the source. So we must all wear masks to ensure that in a community setting. So what type of mask is the best for poor countries? So for poor countries, paper masks are pretty useless. So a mask must have the mask we chose have a pocket filter. This is a mask here. 2 layers of tissue paper is the same as a face mask material. So we can put that in. It keeps the moisture down. Must be fast and easy and cheap to make. And that's why we've gone for this design. It just needs material. Very, very cheap, like I mentioned, $500 for $50. That's just for the material. A mask's got to be easy to breathe through. It's got to be comfortable, but easy to breathe through, so you don't asphyxiate. These tight masks can asphyxiate you. You can't run and work easily in them. So these, this is the design we've got. It's got a bellows action. So when you put it on, it bellows out, and it's really good at mask catching, because that's what we want. We want to catch the droplets. That design, the duckbill type design, is very good. It catches the droplets. You know, the air can go in and out, but we need fabric ones, and we tried many. The other thing is, it must be easy to get on and off your face. So we don't need to be wearing this mask all the time. If we're walking home from the shops or not around people, we can take our mask off. This one's a bit of a problem. It's got to go on and off around the ears. It does work, but we can have easier masks than this. I'll just getting off the top. This is a mask with a one-way valve outlet, so this doesn't stop the droplets getting out. It's still a nice mask. This is an N9. These are the rave of the time, but yeah, it's better to have something that doesn't drop the droplets out through it. And you know, mask wearing can be anything. So why must we all wear masks? Well, we've mentioned that COVID's greatest threat is that 30% of people who are infected hide amongst us. So these are the asymptomatic infected people. So this 30% of infected people have almost no symptoms, don't know or feel they're sick. They happily spread virus droplets in the air and surfaces from their nose and mouth for typically 4 weeks. Then we've got the pre-symptomatic infected people. So this is people who feel fine before and after getting sick. So they're in the village, they're feeling fine, and then they're feeling a bit sort of not so well. And for that 4 days or a week, they're spreading it around their home, spreading it in their communities, that the droplet spread. Then while they are sick, well, we've identified them. They're not hidden in the source anymore, so they're a lot more obvious, and they usually go into containment, and they go in to infect hospitals, care homes, and all that. That's a high risk zones. Paper masks are not suitable for poor countries, mask wearing by all. So why are fabric masks superior? So the fabric masks can be up to 40 times more superior than a paper mask. These are short lifespans face masks. You know, you need 8 per month. You're typically going to need 6 months worth of masks at different times. So, you know, the fabric mask is long life. They can be washed and bleached easily, dried in the sun, where the sun, you know, really kills them. So our fabric masks are worth 40 more. So, you know, for the same price as a fabric mask, you can have 40 of them. And there's just not zillions of these going into poor countries. The second thing is fabric made masks for community have our paper filter pocket. We've mentioned that the filter pocket's important. But most importantly, if we're importing paper masks to poor countries, you're just not going to get the logistics to get it out there. You've got the corruption and all that, and the transport. It's almost impossible to put 240 million paper masks continually, taking them out there every month to do that. The cost is huge, and shipping and getting through customs. So the masks are made where the people are. And we mentioned it has to be easy and fast to make in the village homes. So one lady with a simple sewing machine, 270 masks in 3 days. Have to be very low cost. People are poor. Small materials needed. Our designs are small materials, and you mentioned 500 masks under $50. So also these can require, if you're having trouble with your government, little to no government funding. Village leaders and that can easily pay for the material, or NGOs can provide the material to the right people. You've got to give it to the right people. And then the village ladies, if they want, they can sell them to cover their time to people who can't afford, and give them away to people who can't afford them. Sell them to people who can't afford them. So we found that the village ladies were happy to make them, and then they swapped them for a bit of food and that for their time. So we'll talk about defending actions now. So a big defending action is locate, isolate. So that's test, track and trace. Poor countries can't do this. Does it stop viral? It doesn't stop viral spread from the nose and mouth. So it doesn't stop pandemic risk in that way. Swab testing, temperature testing, smartphone geo-recording on apps. All things that are difficult for poor countries and poor high-risk communities that are villages with thousands of people in. So for test, track and trace, if you were found to be infected and you were not wearing a mask, there's a very high probability that you infected others. If you were wearing a mask or nose and mouth covering, there is a very low probability that you infected others when in a community setting. So yeah, COVID lesson here is expensive. This system of test, track and trace is expensive, requires a lot of police and labour intensive. If you live in a crowded poor country, it's very likely you don't have the resources to effectively test, track and trace and find all the infected people. So test, track and trace is important, but it's more on putting out these flare-ups. It is very good for that. Hygiene actions. This is being yelled very loudly. It's a priority of Western countries. So this is things like disinfectant spraying, hand washing, not touching others, handshake, social behaviour, wearing gloves, having antiseptic hand cleaning. So wearing gloves it doesn't stop it at the nose, mouth and sore. In fact, it doesn't give any protection. It probably gives less protection. It's proven that on plastic, stainless steels and that, droplets last longer on gloves than in your hands, which have got a slight acidity. So, that sort of things, these sort of messages out there are wrong. So if you wash your hands, sneezed into your elbow, practice good social behaviour, and were found to be infected, and you were not wearing a mask, there's a high probability that you infected others. If you were wearing a mask or nose and mouth covering, there's a low probability that you infected others, even though you're washing hands and that. Defending actions, distancing. This is one of the biggest ones. Everybody's yelling, distance, distance, distance. Does distancing stop pandemic risk? It does very little to stop pandemic risk. So distancing does not stop air and surface droplet spread at the source. It only reduces your probability of being infected or infecting others from air contamination. It gives little to no protection from surface contamination. So if you were found to be infected and you were distancing and not wearing a mask, you still had a very high probability that you infected others, whereas if you were wearing a mask and distancing, there's a very low probability that you infected others. So host pandemic criteria, host transmission environments. Environments are really important. So if you're in a high contamination risk environment or a danger zone, we haven't got distancing, high density movement, crowds indoors and outdoors. Winters and summer make a difference with our environments, depending on where the virus is, depends on how long it survives and how easy it can replicate between people. The biggest killer on the planet's natural virus decay, sunlight and UV. This is a natural anesthetic, and it's the biggest single killer of viruses, C19 viruses. And time, 4 weeks is the lockdown sort of time, or longer. So we stop movement and time does it. So basically, again, no host, no transmission, no pandemic. So natural virus decay, outdoor countries are doing much better than indoor countries. Sunlight, outdoors, more space. Outdoor communities do much better than indoor communities. There's no natural virus or distance. Spacious communities do better than cramped, high density, low virus decay cities. So the why. This is a lady in Uganda who started Mask Millions several months ago. She started making masks as a startup. The police, she put them outside her shop, and the police stopped her from wearing them as she was inciting inciting fear in the public. So countries have been stopping them. World Health Organization's been saying you don't need masks, and Donald Trump, no mask wearing. So we've seen this. Whereas the winning countries, Taiwan, they masked up straight away. Their communities like Taiwan never went into lockdown. They enjoyed parks and all that. They all wore masks. There was no droplet surface on the air in the surface. And when they transport, they're all gearing up now. You're going to see this with planes. They're not safe. They're contamination zones, and everybody's going to be masked up in planes during pandemic risk times. So how did it spread? Well, it spread very easy. Everybody just jumped on planes, went all around the world to all these big cities, and smart countries masked up, and the countries like USA, even though they should have been smarter, they were all walking around here, unknown COVID person here, and then they just spread it. So these are extreme COVID pandemic foolish-led communities, and they also told people not to wear masks. And they were telling people all the wrong things. So you may still believe in herd effect, and countries with herd effect really suffered. They killed people. And you can see here, droplets just coming out. All we saw on TV, Australia and New Zealand, was wash your hands, sneeze in your elbows, and distancing, and lockdowns, of course, all this crowd behaviour. So what is FMWBA? That's just fabric mask wearing by all poor countries. So that comes down. We know why we should all wear a mask to reduce our public risk. So just very quickly, this is our infected person. This is in an environment where there's no distancing or anything, and in the natural environment, the sun decay. So natural virus decay is the hugest killer in the millions and millions of cells, and the infected masses. So you've got high pandemic risk, and 100% droplet spread to surfaces in air. With distancing and combined effects of hygiene and that, we've got our big natural virus decay, our unknown individual, but we've still got a pandemic result and infected masses. This is partial mask wearing. Partial mask wearing is good as no mask wearing when we refer to trying to stop, get as near zero pandemic risk factor. So that hardly does anything because we need to get everybody covered. This is where everybody's wearing a mask. So we've got our up to 100% mask catching atrin, got our natural virus decay, which has got very little cells to kill now, and then we've got our distancing, we've got our hygiene and social behaviour and track and trace, and all these items gain exponential when we stop it at the mouth. So there's so much less pressure on these items, and then of course we've all got the mask blocking action for aerosols when we wear a mask ourselves as well. So blocking it at the source. This is actually, we'll just go back. So here, where we're all wearing a mask, we've got a virus leakage factor. So this leakage factor is for non-mask wearing people who are not wearing them in the homes of contaminated people, and that. So we'll always have leakage by out there. Depending on this leakage factor, depends on how effective our near zero pandemic risk is. So these all do flare-ups and those sort of things. So it's worried. This is in a hospital, just a hospital partial mask wearing. They've proven that when everybody goes, the gardener, just everybody's wearing a mask. Everybody in the hospital, that they drop the risk factor. If you visited the hospital, they drop your risk by half by everybody wearing a mask. At first, not everybody was wearing a mask, and the hospitals in Italy and that were the best place to go to get infected. High surface contamination and that. So hospitals and indoor settings, supermarkets, old folks' homes, they don't have any natural or very low natural virus decays, and they have very low distancing. So all the more important to stop the viral droplets from at the source. They have exceedingly high contamination risks, exceedingly high virus leakage factors, and they have to have the disinfectant. So all the doctors and that who advised the World Health Organization thought you had to distance. They compared hospital settings with community settings, but they weren't used to natural virus decay, and they had no distancing. They've been very bad, poor people at advising communities. All these doctors and that, they're telling that they've been comparing hospitals to communities, and they've put the world at risk. This is the amount of viruses. It's an exponential graph here. You know, there's hundreds of millions of viruses going out when we're breathing all the time, and then we've got distancing, which is a factor. It's not stopping the virus droplets. It's reducing our chance of getting it in contamination from air, hygiene and hand washing and social behaviour and test, track and trace. Now, when we bring in mask wearing by all, this blocks it all here, and these distancing values and all that, they come right down to very small values. So the effect of mask wearing here gives exponential effects here to all the other activities. It takes the pressure off. So you know, just quickly here. So we bring the mask wearing in here, and you can see as the mask wearing comes in, more and more mask wearing people. As we bring down, it's exponential cells here, and we bring it right down. It just squeezes down to almost no viral cells for us to protect against. Does distancing stop pandemics? No, it doesn't. It won't stop the viral cells from leaving the nose and mouth. They still do. So we've talked about that. There's a big problem faced by distancing. I mean, we're getting people out there to tell people on beaches to distance, and you know, it's like treating children. Distancing is extremely hard for the public to implement, especially in crowded countries. In poor countries, you can't do it easily, but wearing a mask is doable, very easy, because you just look and see if they've got them. So distancing is still an important action. It's a difficult action to implement, and it does not stop it at the nose and mouth source. So if we want to change the world, we're going to have to start yelling our prioritized actions on TV, not yelling distancing. So you can tell that, you know, these people have had paid campaigns, distancing, wash your hands. They're yelling at us on TV all the time, advertising. Yet the biggest action and loudest at first, and especially for poor countries, is mask up. And if we're going to be on TV, or if we're a person who's an influencer, then we should have our nose and mouth covering on. All right, so we've got to be the example. Donald Trump's not the example. He's not wearing that. So MWBA, mask wearing by all, mask wearing by all. We've got to put that at the top of every speech we do. Here's distancing, so our viral risk, 2 meters. Those droplets are still getting out there, and our surface contamination over distance. Viral droplets can go up to 9 meters, research has shown, so 4 meters. Wind, all those things. So distancing doesn't stop. It doesn't protect us. It just makes us stay safe. If we're all wearing a mask, we don't know who that person is. The mask stops 100%, bang, and then our distancing up. Now, so 2 meters is not safe, but it's safer. Between people masked up, it's 2 meters is probably the same as being 10 meters apart, 20 meters apart, 100 meters apart. If we put a plastic bag over each person's head and we sit in there talking to each other, there's no way the viral droplets can go out. So masking up, just really significant benefits distancing. These are some of the other ridiculous things they've been yelling to us on TV. They're telling kids at school and all this, don't cough into your hand, cough into your elbow. The droplets are still getting out there. They're still in the schoolrooms. It's not doing anything. Effectively, it's trying to be a mask. You're using your elbow as a mask, and you're just putting droplets everywhere on your hands and that. So by wearing a face mask, coughing into your elbows, it's not getting out. It's being blocked. But we're not sneezing anyway. We just have to be breathing to get this. So don't think that people have to sneeze to put droplets out. Almost all of the droplets that are going out there are from breathing. Puffing, if you're running, you're puffing more. If you're singing in a church, you're putting more droplets out there. So anything where you're huffing. She's not allowed to blow tobacco smoke in your face. By law, you're not allowed to blow tobacco in your space. It might give you a small risk of cancer. But she is allowed to blow COVID in your face and put it on the droplets all around you. And here she is out there saying, my body, my choice. Well, sure, but not in a public space. So we're going to have to globally protect our communities. These people have to go and not give them any airtime for sure. So we need to bring human rights for at-risk community settings, especially poor countries. They've got leaders like in Brazil, it's genocide what they're doing. Even the Western leaders genocide of the amount of people they've killed. So during a pandemic crisis, we need to be all protected from leaders. We should all have the right to be in a public place or in shops and that. And this is what I wrote up. No infected person has the right to infect their communities or cause the death of other people by not wearing a face mask or nose and mouth covering during a pandemic risk time. So no infected person has the right to kill other people in a community setting by not wearing a face mask. So that'll need to go. It'll be in human rights. Be wise, focus, prioritize. This is the World Health Organization. This is your doctors. This is your ridiculous. This is my teams out there, and they've got this wonderful stuff. These are our signs. We couldn't afford to make these booklets. On the front page, it does not say mask wearing by all. And here's a little child here at school, and we're teaching him low priority shit of washing hands and sneezing into elbows. It's not even. I don't know what to say. I can't even watch the news. It's so ridiculous. We need to be listening to good leaders. And here's these poor communities out there spraying people with disinfectant and all that. And it's a placebo, maybe spraying someone's house after it's been infected with a person. And these are the causes of it. So this whole pandemic's been caused by our own actions, our leaders' actions. So practice good hygiene and personal hygiene. Yeah, it's a bit of a given. Of course it's important. I'm not saying it's not important. But what I am saying is don't prioritize it above others. And that same sign that they paid for on Twitter and all that to get out there, do not wear a face mask. And this has been going on so long. There's a big public lag factor. do not wear a face mask, and all our teams are having this propaganda throwing them that we could not fundraise for this project because people were saying that that face masks don't work. And also lesson that says that do not wear a face mask if you are well. Well, 30% of people feel well who are out there, asymptomatic people and pre-symptomatic people. They feel well at the time, and that's why everyone has it. Crazy stuff, crazy stuff. So why did they lie and promote mask wearing by all? That was done by World Health Organization, MDA of America. They did mass media campaigns. They've confused people. They've used false science to convince you that mask wearing by all was dangerous. Do not do it. Do not use masks. And they even banned people from wearing face masks in some societies. So there's WHO, World Health Organization, and one Changing America. This was everywhere at the time. You may not have noticed it because you didn't think it was important, but no evidence wearing a mask can protect healthy people from coronavirus. This propaganda everywhere. So why did they do it? They were fearing their emergency services would run out when the pandemic hit. Losing countries campaigned to public that face masks did nothing to protect them and to not buy them. So these guys caused the pandemic. So did World Health Organization actions cause global pandemic spread by saying do not wear a face mask? Yes, most definitely. They are directly responsible for global pandemic. This is Masks for All, some of our guys. This was a photo I took a few days ago. This Donald Trump was one, his head of health, wearing a face mask. It's coming in, but we need all of us. Chris Buttonson and Dr. Jeremy Howard. These guys started the same time we started with it's Masks for All. Fantastic people, but now we've got to have this face mask. We've got to wear it. We've got to be the example, and wear the mask. It's really important we all start wearing the masks. Just lastly, if you're a losing country and you're coming out, like Italy and Spain and that, and you're coming back into stability and going back to your jobs, you're going to spin straight back into a pandemic crisis. So you've got a choice: either mask up and join winning countries and reduce your pandemic risk, use all your other items to put the flare-ups out and continue until either a vaccination comes or we slowly suppress it. So you've got to be the change and just follow winning countries. Thanks very much for your time watching this. I hope it's cleared a few things up. Our teams really desperately need funding our startups. We're trying to get this message out to bigger people. And it's been a really frustrating project, but we have made millions of masks and we've helped protect millions of people in their communities. We just got to keep it going. Thanks very much.